Welcome! This is day 2 of the 5 Days to Clarity Challenge. Today we're going to be talking about how to read an audiogram, and I have it all prepared for you guys to get the best understanding of how to read the audiogram, what do all the different parts mean, and then when you look at your child's audiogram or your own or your family member, your parent, your cousin, whoever, you'll be able to look at an audiogram and know how to interpret what does it mean. I'll remind you that this is the 5-step guide to navigating your child's hearing loss, and it's a free printable with questions for you to answer to help you through the journey. And this week we're going through the different questions in these lives to help you work through some of the questions along this journey, because there's so many things going on at once, it helps to break it down. So today we're going to be talking about how to read an audiogram. And the audiogram is the hearing test results that you get when you go to the audiologist. And what you see on the audiogram is that it's a chart with a lot of lines going this way, a lot of lines going this way. It looks kind of like an overwhelming graph. And it has symbols, circles, X's, all sorts of other little symbols. And so it's really quite simple once you break it down. So that's what we're going to do right now. So the audiogram has from left to right is what is the frequency. And by frequency we mean like what is the pitch. Is it from low pitch to high pitch, kind of like across a piano. So when you have the results graphed out and when we test hearing, we don't just play one sound and say, did you hear that sound? We play a lot of different sounds. Low beeps like boop, 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 and super high beeps beep, 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 like birds, right? And all the sounds in between from 250 hertz to 8,000 hertz, right? So we're getting results from the low frequency all the way through to the high frequency. And so that's what it means when something is on the left versus the right. And then going down the chart, we have the decibel scale, or how loud were the sounds that we made for you to hear them, right? You're in the booth and you're wearing headphones or earphones and the audiologist is playing sounds for you to hear. You have to raise your hand every time you hear the beep. So what the audiologist is trying to do is find out how loud do the beeps have to be before you're able to hear them. And so if you can hear them when they're super quiet, which is right up here, then they'll mark down the responses up here. And if they have to make the sounds louder before you raise your hand, louder and louder and louder, then that's how much hearing loss there is. So the lower down on the graph you are, that corresponds with more hearing loss. So what are the different, well, I'll just mention for 1 second that I prepared all of these little cards with my daughter's markers, and then she came and added hearts on all of them. So she is delightful, and we're going with it because it's very cute. And you can always remember that through all of this, it's really important to be grateful and, take things as they come. So let's say you have these kind of results. Red circles are for the right ear, X's are for the left ear, red and blue, red right, blue is left. And so you're going to get responses all across the different frequencies, right? So this would be a normal test result with all the circles and X's way up high at the top. And so right around 10, 15, even 20 decibels, that means that the sounds are very, very quiet and you're hearing them quietly at all the different frequencies, all the different pitches, low sounds, low pitch sounds, and high pitch sounds. You're all hearing them at the same low level. But then if there's a hearing loss, then this audiogram might look like this, with a mild hearing loss at around 40 or moderately severe at around 60 to 70. And the lower down you go, the more hearing loss there is. So if you see an audiogram with the lines, the circles and X's all the way at the bottom, then that's essentially a hearing loss that is profound. It's sometimes referred to as deaf. And the other thing about this one is that they're all basically the same across all the different frequencies. So we're talking about degree. Is the degree normal, mild, moderately severe, severe, profound? But we need to also know another thing about the hearing loss. This one is flat. all the hearing loss at the different frequencies is the same. But what if you have a sloping hearing loss, meaning that the sounds, you need to hear the sounds at different volumes for different frequencies. So for this one, the low frequencies are coming in at normal, which is to the left. I'm sorry that this is a mirror image, but it's to the left. The low frequencies are coming in normal, and then the mid frequencies have some hearing loss, and the high frequencies have the most amount of hearing loss. This is very common with as we age, and older adults have this kind of hearing loss generally. High frequency, also called sloping, because it's like a slope. And we also see something called a reverse hearing loss, where it goes the other way, where the majority of the hearing loss is in the low frequencies, and then high frequency sounds are coming in at normal. So what does all this mean? Because it's a lot to take in all at once. But when you understand the basic geography of how the audiogram works, then you can interpret whatever the results are on the audiogram that you're looking at. So closer to the top is normal hearing. The lower down you go is more hearing loss, the degree of hearing loss, how much hearing loss. And from side to side, it tells you what kind of frequencies are affected. If it's to the left, that's the low frequencies. If it's to the right, then it's the higher frequencies. And why this matters is because we have different sounds of speech. We have, for example, vowels, e, all the vowels are kind of lower frequency, lower pitch, whereas some of our consonants like t, the letter T, or s, the letter S, these have a much higher frequency for the sound. And when we're speaking, we're using all these sounds mixed up all together. But someone who has a high frequency hearing loss has a very common concern when their hearing loss looks like this, and they're hearing just fine. Like, they can hear that someone is speaking, they can hear music, they can hear things going around, but once they need to understand the clarity of different sounds in speech, like did the person say a word that had an S or an F? Those are really similar, and if there's a high frequency hearing loss, they might not be getting those sounds, okay? And we also have another configuration, so how it looks. The other configuration is a cookie bite, which looks something like this, where you have normal hearing in the low frequencies, normal hearing in the high frequencies, and some hearing loss dipping in the middle. The cookie bite configuration is sometimes seen with hearing losses that are due to genetic mutations or things that are hereditary and congenital, so from birth and running in the family. This is less common in when hearing loss develops later in life. So those are the different configurations. And the other thing that you may have heard of is the speech banana, which, if you have an audiogram, sometimes just a blank audiogram will have this kind of shaded region right here in the middle in the shape of a banana. And that's just why they call it the speech banana, because it's kind of this oval shape. And what it shows you is where are the sounds of speech. Like, they'll put all the different letters in the speech banana, higher frequency consonants in the higher frequency section, and the vowels over here, and then the other letters like sprawled out around it. And why this is important is because then you can take the speech banana and overlay whatever the hearing loss is and see how much of the sounds of speech a child is hearing, or someone with this hearing loss can hear. So any sounds that are above the speech banana, then they could hear just fine, but any of their hearing loss that's coming in under the banana is where they're missing those sounds. So that's why the speech banana is a helpful little tool to understand what the hearing loss means. What are the sounds that somebody is hearing versus missing? So for a quick review, and I'll bring you just a little bit closer to here. The top goes from low frequency to high frequency, and going down, you're measuring in decibels, getting to the loudness. All right. So the reason it's important to be able to read the audiogram and understand what the hearing loss is is because once you know what the hearing loss is, then you'll be able to know what the next plan of action is. If there is a high frequency hearing loss, then maybe the hearing aid is the right option to bring all those sounds that are missing back up to normal. If there's a flat kind of hearing loss and it's caused by something in the middle ear space, like fluid in the ears or anything like that, then we'll know, then it's a different kind of treatment options when there's a different problem. And when the audiogram, are all the way down here and there's a profound hearing loss, then we know that there's different options, like perhaps a cochlear implant, and knowing what the hearing loss is often will tell you what are the options that you can then do. And I hope that you'll come back for tomorrow's live lesson, where I'll be diving in more into those treatment options. Now, I have someone asking a question about the speech banana. So exactly, what they're asking is, does the speech banana represent the normal sounds of speech? And that's exactly right. So the speech banana goes right around maybe 30 to 40 decibels, and because of the slope of it, it's showing that we have sounds in the sounds of speech are the low frequency and the high frequency, and the mid frequencies are a little bit lower. But that's exactly right. That's where the sounds of speech are, and why it would be very helpful to have a speech banana overlaid on your audiogram. And if you don't have this, then you can ask your audiologist to put your child's audiogram over a speech banana, or you can do this on your own just by Googling a speech banana audiogram, and that will come right up for you with the exact numbers. Great question. So we've talked about the audiogram and why it's important to know how to read it. This was a very quick overview, and I hope it was helpful to you. But if you have any more questions, feel free to leave them in the comments. And thank you so much for joining me for day 2 of the 5 Days to Clarity series. I'll be back tomorrow talking about treatment of hearing loss. And as a reminder, the 5-step guide to navigating your child's hearing loss is for you. It is a free download. You can also do it on your computer. It's a fillable PDF. And there are just 5 questions to help you organize your journey and get you on your way. So thank you again for joining me. I'm Dr. Lilach Saperstein, educational audiologist and host of the All About Audiology podcast, and I'll see you tomorrow.